And Gertrude's Hospital Foundation has launched the second annual childhood cancer charity walk that seeks to raise at least 10 million shillings to improve cancer diagnosis and treatment in children. Slated for June this year, the walk seeks to train at least 2 teachers in primary schools, neighboring Gertrude's Children Hospital clinics, and sensitize frontline health workers on early signs of cancer in children. Mark Kimondo reports.
The World Health Organization in 2019 ranked cancer as the leading cause of death in children, with 300,000 new cases diagnosed each year among children aged between 0 and 19. In that world, countries like Kenya, treatment success rate of cancer in children is less than 30%. The treatment of this pandemic disease is pretty expansive and beyond the reach for many families. Gertrude's Children's Hospital is one of the organizations that has been strongly campaigning on the childhood cancer by offering a modest intensive care for kids suffering from cancer.
We have a Githogoro clinic. We also do medical camps, and we have a mobile clinic that goes around providing health care to people in the communities.
The hospital began to raise awareness on childhood cancer 30 years ago through the Gertrude's Hospital Foundation that has been conducting medical camps and healthcare trainings for people in the society.
We've not had, any other of our public hospitals being able to provide some sort of management for childhood cancer. So that's why we are very keen on having this partnership, because it helps us, start building capacity, especially across the counties.
Through the foundation, the hospital that receives at least 3,000 cancer patients annually has today launched the second edition of the Gertrude's Charity Walk, pointing at enhancing awareness and proper diagnosis of childhood cancer.
We have our charity walk on the 28th of June, and this will be at the University of Nairobi graduation grounds, which is not too far from here. And this will be early in the morning at 7. We want to support children with cancer.
The foundation is targeting to raise over 10 million Kenyan shillings that will be used in training health workers on the pediatric cancer management and surpassing childhood cancer treatment in the country.
So Gertrude's Hospital Foundation believes that if we raise the awareness of childhood cancer in Kenya and sensitize health workers to be able to detect these symptoms at the onset, early on in the disease, we can be able to achieve a higher survival rate.
Only 20% of children with cancer are treated successfully in Kenya, unlike in high-income countries where the rate is at 80%.
The Cancer Prevention and Control Act of the Kenyan Constitution, Part 1, Act 3 of 27th July 2012, clears that the state shall promote public awareness about the cause, consequences, means of prevention and control of cancer. The foundation that promotes public awareness on childhood cancer is planning to partner with NHIF, which has been working close with Kenyans in raising an alarm on cancer diagnosis. However, Gertrude Hospital, that has partnered with the Ministry of Health through the National Cancer Institute, decried some shortcomings, including limited number of healthcare workers trained on pediatric cancer management, infrastructure, among others.
Great things are not done by impulse, but by a series of small things brought together. It is such a big step from Gertrude Hospital's Foundation and the Ministry of Health in the fight against childhood cancer, believing that the treatment rate will rise up to 80%. Mark Kimondo for Hope TV, Nairobi.